Hi, this is Mahendran Subramanian, the founder of Business Arena 365. We have with us Dr. Om Bedekar, a leading psychotherapist, who's the founder of Om Mind Care, who has a unique way of treating people. It is a great privilege and honor that he has given us his time to talk about what he does as a practicing psychotherapist. So let's dive deep with him to know more about him. Hi, sir. How are you?
Fine.
Thanks for giving your time.
Most welcome, most welcome.
Yes, sir. So you are earlier in the army.
Yes.
So how was the shift like?
So I served in the Indian Army and I did my specialization in psychiatry there,
Wow.
and thereafter I quit the army to be able to work in a broader field.
So what made you come out of the army, sir? Because that's
So
it.
in the army the field is a little bit restricted. As you know, we select people who are already quite normal and very fit and
Yeah.
healthy. Yeah. So population of sick people is less in the army.
Okay.
Whereas in the civil life, the people have a lot of problems, and there is a greater scope for
Helping.
bringing relief and helping people.
Okay. So you wanted to have more people. That's why you came out of army.
Yes.
So
And everybody has to retire at some time.
sometime.
So I chose the time when I wanted to get out.
Wonderful. That's great. So now you're reaching out to more people, and that is giving you more satisfaction.
Absolutely.
So what kind of services do you provide, sir?
So I'm providing the service of psychiatry in general, which is treatment of illnesses like schizophrenia, bipolar disorder, personality disorder, and various others, including dementia. Apart from that, my main contribution and the difference with me is that I'm involved in psychotherapy. So I've spent a lot of time to learn how to be an effective psychiatrist and psychotherapist.
Okay. So how's it different, sir, from others?
So difference is normally what happens is psychiatrists are treated as medical
Yeah.
persons whose main job is considered to be giving drugs. And though drugs do have a role,
Yeah, of course.
especially in the serious conditions and the emergency conditions, and even in normal conditions to give kind of support. However, they have to be accompanied by psychotherapy. In fact, many times I will say that psychotherapy is this much and drugs is only this much. Yes. Whereas the medical model says that drugs will be so much and supportive psychotherapy will be so much.
So in that case, side effects are reduced to a greater extent.
Yes, absolutely. I believe in giving the minimum dosage to people and just effective enough to cover them for a period, which will be a short period, to finally come out and be in the natural state, which is not to have drugs.
So that's wonderful, actually. So you've been doing this for how long?
So I'm in private practice here for last 2 years at Balewadi in Pune, and I do online also, and I have my clients from Delhi, Agra, Bombay, and even abroad like Germany and USA and so on.
Wonderful.
Yes.
So a lot of people from abroad also reach out to you.
Yes.
Okay. So
Basically, those people are the ones whose relatives first took treatment here,
oh,
and then they told their relative there in Germany
so
that this is a good doctor, and then they
word of mouth.
Yes.
Patients. Wonderful.
Yeah.
So these days you see a lot of people are getting into depression and things like that because of
Yes.
the gadgets and other things.
Yes.
So you might have seen even youngsters, they get depressed, they go into depression or they're a little off track. So
See, nowadays, young people and old people and everybody, they are under tremendous stress, and the whole system is such that distraction is the norm and focus is the exception. So people are distracted by gadgets, they are distracted by various things,
Yes.
including internal dialogue, which goes on inside, and that is also very distracting. So this
Oh,
internal dialogue can be in two forms. One can be a psychotic internal dialogue, which is when people go crazy and they're doing things like that and talking in the air and responding and things. And another internal dialogue is for people like you and me. We are having some dialogue which we are carrying right from very long ago, or sometimes 2-3 years back, and so on. So that is the internal dialogue which has to be addressed.
How do you do that, sir?
Also, this is sometimes called as positive intention, because there are parts of us which are suppressing us, depressing us, and saying a lot of things
Right.
about us. Sometimes, in fact, many times, most of the times, even this pathology, even the symptom, even this dialogue, it is serving some purpose. It has a purpose in their life.
Oh.
It is in fact protecting them from something else.
Okay.
Yes.
Some kind of indicator?
So in common terms, we say that, for example, in common language, we say that a person flipped.
Okay.
So sometimes what happens is that there is a deep trauma inside. Now the trauma, the hurt, the pain is so much that the patient prefers to flip the reality and go into psychosis, or they go into neurosis, they go into dysfunctional behavior, they go into paralysis by analysis, they go into so many things because they don't want to attend to that pain which is there inside. There is a pain, there is a trauma, there is an abscess, you can call it even an abscess. There is एक फोड़ा होता है, वैसे फोड़ा हो जाता है. किसी को लगता है कि मेरे दिल में बहुत बड़ा छुरा भोग दिया किसी ने. Like a bhala, you know, bhala
Yeah,
is
spear.
that spear. So the people feel that I have been attacked with a spear in my this thing, and they are holding that and they can't hold it. So what they do is they either become numb or they flip into a symptom which falls in the rubric of psychological symptoms.
Oh, that was wonderful, sir, for my viewers. So, any giveaways you have for?
So the demands from the world are such that the world demands now that we work a lot, we earn a lot of money, we do a lot of activity, we do a lot of things, we do it in a masterly way, we do it with full devotion. They say you work, get the other things online, don't go anywhere else. You just work, either in your office or from home or from your shop or whatever you are doing. You just continue working and outsource your things else other things to entities like online entities.
Yeah, online shopping.
Yeah, so you don't cook your food, eat your food online, order it matlab online. You buy your stuff from Amazon and other things.
Doctor, can you tell me something about communication in terms of therapy?
Yes. So what happens is there is a limitation to words.
Okay.
One thing is that words themselves, the verbal communication component is only 7%, and the non-verbal communication is 93%.
Wow.
That includes the tone, intonation, and all kinds of things. Now, another issue with words is that when one person is telling me that I am depressed, what I think of depression and what he is saying is very different, because the person is actually, he may be agitated, he may be anxious, he may be depressed, but because of something else is there is a belief, for example, which is the main cause and not the depression itself. The depression is absolutely secondary. So we go to the actual thing, and for that we use non-verbal communication. We go for what is the experience. One more aspect to this is that 10 people who are labeled as depression, their experience of depression is very different. I'll show you, for example. One person is experiencing depression like this. Another person is experiencing depression like this. Third person is experiencing depression like this. And there are so many ways. So these are different expressions of the label of depression. So to do that, what we do is like make the people move around. I see their whole non-verbal communication. We don't chat. In therapy, we don't chat. We don't discuss. We don't give lecture. We don't give advice. At least in my place. I don't chat, discuss, give advice or anything of that sort. What I do is I understand what is the experience. I make the client understand and corroborate, is this the experience? And then we decide from here, from this experience, where he wants to go. So he wants to go here. So this experience again is defined in very well defined outcomes. Very well defined outcomes. So that for that again we use the body. For example, if somebody saying I want to be free, so ask him, does free mean like this for you? Or does free mean like this for you? Or does free mean like this for you? So free can mean so many things. So what he wants is important. He is the hero of this therapeutic movie which is going on here. I am not the hero, I am just the facilitator. So my job is to understand his experience, for he also to understand his experience. Then we understand what is the experience he wants. Then I understand completely what is we have a full understanding of what is the experience that they want. And then from here to here, we use all our 30 years of repertoire of number of skills, so that how he can come from here to here, and then from here also if required he can even bloom further.
Wonderful, wonderful. Very artistically expressed. Explains.
Even for normal people, so-called normal people who don't have a conflict, who are not having anything, but just feeling maybe a little low or tired or something, we have some techniques which can make them absolutely centered and just open up, expand, and feel absolutely comfortable and very positive and be fully ready to do whatever is to be required to be done in the world.
Right back.
Yes.
Wonderful, sir, wonderful.
Thank you, thank you.
It was so nice. I really enjoyed doing this session with you. You're so
We have a lot of
artistic
fun.
and expressive.
We have complete fun.
Amazing.
Here therapy is fun, it is very playful,
I think I
absolutely
should have
playful.
much longer video next time.
Yes, we do have a lot of fun, we have a lot of humor, we laugh like anything, we cry also at times, that is also encouraged. But it is done in a playful manner, because that is the one which reaches really the person. Yeah, and I'm extremely thankful for the people who give me so much trust, so much affection, so much respect, and who are willing to do what is required in the interest of their therapy, and which is why they get very fast results. In 3 sessions, I can do wonders with the patient. So I call them 3-session wonders. The illness which is there, the symptom which is there, so a symptom like depression, a symptom like sleeplessness, a symptom like inability to work, a symptom like loss of focus, inability to attend to things. All these arise because there is something, some FU which is happening inside. There is some kind of thing which is preventing you. You are trying to go like this, but you end up going like this. You want to do X, but you end up doing Y. So our endeavor is to enable you to handle the thing which is making you to go to Y, and then allow you to go very smoothly and directly to that X in an effortless and masterly way.
Oh, wonderfully put across, sir. Thank you so much. So that was wonderful talking. You want to add anything else, sir?
So
Finally, before
let
we
me tell you,
conclude.
you were asking me how do I do that thing. So I'll tell you another way, in a metaphorical way. So suppose that this person has this pain, this poda, there is a poda there is an abscess, which is a big abscess, which is hurting like anything. The person doesn't want to attend to that hurt and pain and all that, or he's partly conscious, partly less conscious. So he's producing all his system is producing those symptoms. So what we do is, first of all, we excise that, we incise that, we open that thing, clear all the muck which is there in that abscess, and after clearing it, in the next session, we do what is called as polishing and buffing, and during that what we do is we put some wonderful seeds of exotic and lovely flowers inside. So when we put the flowers inside, over time they grow and they bloom, and when they grow and bloom over time, then this has a long lasting effect of comfort, of beauty, of grace, of calmness, of peace, and so on. So the person who was earlier dysfunctional now becomes functional.
Wow, awesome. Very beautifully expressed, sir. Amazing.
Another simple method I will tell you what we do, another way, all this has to be explained metaphorically, that a person should be like this, suppose, but he is like this. So this is like a chiropractor.
Yeah.
So whatever is just what is broken, we fix and we bring it here. Yes, just do this. So he becomes straight and he can do whatever he wants to do.
Right.
Now you may have seen a chiropractor who is a bone setter. So he doesn't use drugs, he simply does some maneuvers, some manipulation, and then the person becomes all right and they are ready to go.
Wow.
Yes.
So that was wonderful, sir.
So this is called brief psychotherapy.
Brief, sir.
This is called brief psychotherapy.
Maybe sometime later we'll get into it more deeper.
Sure.
Thank you so much, sir. It was lovely talking to you.
Yeah.
It was a pleasure. It's very useful to my viewers.
Yes.
Thank you once again.
Another thing I would like to tell you, that having come from army and from the government, and my original nature is like this, that one of my cardinal principles is that no harm to the patient. If I cannot solve anybody's problems, I don't pretend to solve, because I already have so much knowledge and information that if there is 1 or 2% people to whom I say I cannot help you, that is absolutely okay with me.
Right,
Yes,
Right.
and at any stage during those 3-5 sessions, whatever, if I feel that this person is not going to benefit it or he is not ready for this kind of therapy, then I tell them, I'm sorry, you please go to another one. Either I will suggest you another person, or you can go on your own.
Okay.
So I don't prolong anybody's
That's very good, sir.
agony or trouble or yes.
That's very nice.
Yeah. But usually in 95% of the cases, if not more, the things work beautifully and they work like this.
Wow.
Yes.
Amazing. That was nice, sir. Thank you. Thank you once again. Take care. Bye.
Please do like, subscribe, and watch.